everybody. My name is Judy Loche. I'm your host for today's show, Have a Chat. And of course, I'm with my beautiful co-host, Vero Arsenault.
Always so kind to say.
Yeah, and we're here on a sunny, sunny day in Miramichi at the Rogers Studio. Happy to see you all. Thanks for tuning in. So we always start our show with a quote, and I've asked Vero to bring it.
Yeah, and so listen, it's all about women today.
Yeah, Women's Day.
It is all about women today. And so the quote actually really, I see this one often and it really speaks to me, so I thought it was a good day for it. So it's from Amy Morin. No, but that's okay.
Yeah.
Me either. Be the woman who fixes another woman's crown without telling the world it was crooked.
I love it. Behind the scenes, just gently give them advice or say
whatever
something whatever would improve them, do it gently and don't be in front of people and make them as best you can.
Absolutely, and I think it comes back to support and the reason why you would either tell someone that something didn't work or wasn't working or wasn't good was to help them, so it doesn't have to be in front of everybody.
No, exactly. I like that. I love to support other women.
Yeah, like if when you tell me if I have a booger hanging, not to do it on camera.
You have a booger hanging.
I know. Thanks.
So we are going to have a fantastic show today. We're talking about women's health. And I've been asking her, and she's gracefully said yes to coming on our show to talk about women's health entirely for the show. And I welcome to the set Holly St. Coeur. She's lovely. She's a nurse practitioner with the Miramichi Health Center, Women's Wellness Clinic. And get ready, men or women, you're going to be well informed today as to what we're talking about and it's health. So, welcome, Holly.
Thank you so much.
Tell us all about yourself, your marriage, your kids, a little bit of fun stuff about your background.
So I'm originally born and raised in Miramichi.
Yes.
So I've been here my whole life. I met my husband here. He's from Douglasfield. So we've been together for 16 years now.
Nice.
We have 2 little kids, 5 and 8.
No, they keep you busy.
Boy, girl.
A boy and a girl.
A boy and a girl.
Yep.
Millionaire's family.
Yep. And so we basically, my husband and I pushed each other into these kind of roles. He's a pharmacist now within the community, and I'm a nurse practitioner. But I first started, I did my undergrad at University of New Brunswick, and I graduated in 2013, and basically stayed within women's health for my whole career.
Good for you.
I was in obstetrics and gynecology for 8 to 9 years, and then I kind of branched out and went into my nurse practitioner, and here I am.
And you're doing awesome.
Just last year I started. It'll be my first full year.
Very proud of you, Holly. Aren't you? So we have lots of questions for Holly
Well,
today.
and it's incredible, and that you dedicated your career to women's health, really, because it's there's so many intricacies to it, right? And so much information to share. So, and I know that we're going to go through a lot of really important information today, so that's fantastic. And at a certain area in my life that I am now, it's always good to learn more about what that's going to do for me. But when we talk about services for women, for females here in the area, there's the Women's Health Center and the Women's Health Clinic. So tell us a little bit about that, the services there, and where that is.
So we're located in Newcastle, so right behind the courthouse. So the Medical Arts building is in the first floor, and then we're up above. I work with Dr. Leonard, who is another primary care provider, and then we have another registered nurse there as well that helps us out. And it works very well. So what happens is we have pap tests every week on Thursdays. And I actually recently started doing intrauterine devices, so contraception, which is we are just starting to do every second week to help kind of alleviate that need, which is there. As well as I do breast exams. I focus on basically all of women's health, sexually transmitted infections, menopausal symptoms.
Right?
I know. I'm
like, stop breathing. No, I'm joking.
I know. Yeah. I'm like, I don't want to talk about me this whole show, but like menopause is just another experience altogether.
But let's just go right back to puberty, because we've all been there. Everyone that's watching this show has been through puberty. So basically, let's just say it. The girl begins her menstruation cycle at what age, roughly? I know I was probably 14, which I consider a little bit late, but we want to talk about that. Parents sometimes don't have the talk to their kids. They hear things on the street, and and then this happens, and the little girl's having her period, and all of a sudden it's, oh my gosh, what happens to me now?
Exactly.
What do you experience?
So, I mean, usually a menstrual period starts around 9 to 15. That's basically the age gap. I
That
mean,
seems so early.
9 is.
Yeah,
Oh,
and
it
I
seems
mean,
so early.
it seems to be getting earlier and earlier.
Really?
It does. And I mean, the majority though are between 10 and 13,
Okay.
14. But like I said, there's still that 9-year-old age too. Also, usually puberty starts between 9 and 13, so you're going
Because
to
everybody's
notice
body is
different,
different, right?
yeah, everyone's
Everybody
different.
progresses in a different
I know.
way, in a different
Exactly.
rate, and all of that, right?
Yep. So you can't really predict when things are going to happen, but the first changes are breast budding. You're going to notice your breasts are going to start changing. They're going to be a little bit bigger. Your nipples are going to be a little bit bigger. So, and it's nothing to be, it's just a unique change.
Yes,
Yeah.
of course.
We got to kind of embrace it. And
Coming into
I mean,
womanhood.
Exactly. And I mean, it's always good if parents are nervous or if the child is nervous to always talk to their practitioner. I mean, it's a normal part of life, and
Of
everyone
course.
goes through it.
Yep.
Yeah.
Okay, so
Yeah.
that's good. You deal with all those girls that
Yeah.
might want to come and say, look, this is happening to me, and then you talk to them and
And-
secure the fact that life does go on,
Yes.
that it's only once a month of hell.
For a very long time.
yeah.
Yes.
For a very long time. but it's true that it's sometimes really tough for parents to have that conversation,
Yes.
right? Like
Definitely.
I remember when poor Dad tried to have that conversation with me.
Your dad?
Dad did, yeah,
Ah.
Dad did, and I remember I was not going to have it.
Yeah.
I was not going to have it. I remember him trying to, broach it with me, and he brought out the encyclopedia at the time, and I was like, nope, I know nothing. I noticed no differences. I know nothing about it. Never, and he had just refused to talk about it. And I think it's just such a tough subject, right? We get
is.
embarrassed.
Well, you get
Yes.
body hair too in different
Yes.
places. You're growing. There's hair growth. There's all
Yeah.
of that
All
hormonal
of that
change,
stuff
mood
happens.
changes with teenagers and everything.
Yeah.
It's a
Yeah.
lot to deal with.
It's tough, but it's great to know that you can help with that.
Oh, definitely.
Yep.
Being open with them and making sure that they're aware that it's not abnormal.
Right.
Things are happening, but
Right.
everything is the way it's supposed to be doing.
That's right.
Absolutely, absolutely.
Yeah.
Now, contraception is also one of those really big discussion points, right? So, and it's hard to have that conversation with,
Yes.
maybe the young person in your life or with your parents or whatever it may be. So, what are the options? What's most effective, and how do you take? Like, are they all oral or what? Like, how do you take them? How do you get there?
Yeah. How do we get there? So there are a lot of different contraceptions on the market right now. There's short-acting methods and there's long-acting methods. So it all depends on where the woman or the young adolescent is at. If they're not looking to get pregnant within a year, then it would be a long-acting method would be maybe the most optimal. If they are,
I'm just
okay.
listening. I'm intrigued by
Okay.
it. You have so much information.
Yes.
As well, I'm
Okay.
very tuned to you.
And short-acting is usually the majority of people take short-acting reversible contraception. So some of the short-acting ones are like the oral combination medications, so the pill. Or if someone doesn't want to have estrogen and progesterone in their pill, because some people aren't able to take both because they have either headaches or high blood pressure or
Yes.
things that are contraindicated. So they can have a progesterone only pill, and that would be helpful. There's also the Nuva ring, which is inserted vaginally. You only have to insert it once every 3 weeks. And then
interesting.
and then you have a period of 1 week off, and then it continues like that.
Okay.
The patch is another one where it's an option rather than taking a pill every single day. You put the patch on anywhere where there's soft fatty tissue, like in behind the arms or on the buttocks. You put that on once weekly.
That's interesting too.
Yeah, for 3 weeks and then 1 week off. So it's the same type of thing. And there's also the Depo-Provera. That is the injection that is given every 3 weeks or 3 months. Sorry, and I mean it's all the preference of what the patient wants, right? I mean, you have
in
to have
consultation, right?
Yeah,
so
you
like
have to have
gonna,
a discussion to
right,
see
they're
what
going to
they're
come
wanting.
to you and talk to you and see what's
what
best for them, for their
Exactly.
health, and,
Yep.
and what you can recommend, right?
Just listening to you, though, I would think that it's so easy to take the pill. You know, it's in the package, and you just take
It
one.
is.
So why, if not for reasons that they can't take them, would people not opt for that for the most part?
A lot of people have a problem with remembering.
Oh,
So you have to take them usually at the same time every day.
yeah.
Even if you tell them to continue taking them, maybe you use an alarm clock or put them beside your bed. When you wake up, take it every
Yeah.
morning. Some people just don't remember, and
Okay.
they know, but those are the people that know that I can't take the pill.
Yep.
I need something other than
Because
that.
I forget.
I can't do it.
Are they of equal protection, would you say? Like, is there one that protects you from becoming pregnant more than the other? Or is with the pill, you forget. It's easy to get pregnant if you skip your pills. But the other ones are equally safe if you're continuing on the right regime?
Yeah, well, with usual use, the pill and the Nuva ring and the patch are pretty good at protecting you against pregnancy. I think 3 out of 1,000 women would get pregnant if they were doing like perfect use.
It's still a possibility.
Oh, definitely.
It's not
I've met
100%.
those people.
It's,
Yeah.
as have I.
I know
Yeah.
those children.
Yeah, as have I. Yeah, like it's
Yeah.
not, and that's the thing, right? So I want us to make sure that we're, that as you're listening to all of this, so we're providing some information here. We're not
Yes,
advocating for
definitely.
anything.
No.
But the second thing is that there is nothing that is 100%
Definitely not.
when taking a contraceptive method.
There's not.
There's nothing that's 100%.
No, there's not. And I mean, there is some contraception that is more helpful than others,
Yeah.
or works more better than others, I
Yep.
should say. So long-term contraception would be the IUD. The IUD or the actual implant. So there is a new contraception. It's Nexplanon. It's an insert that goes into your arm. And it's,
Amazing stuff.
yeah, it's progesterone. And that is good for 3 years.
Oh,
So
interesting.
it stays within the arm for 3 years, and
Okay.
it just releases small amounts of progesterone through the day, and
Interesting.
kind of
It's pretty fascinating stuff, isn't it?
Yeah, and there's also, because I taught this for a very brief period of time, there's also, you can combine some contraceptive methods. So,
Yeah.
The pill and a condom,
Exactly.
or, and really we want those condoms introduced because it
Yep.
protects against those transmitted
Double
infections.
protection as well
Yeah.
with the
Yeah,
girl
absolutely.
and boy.
100%.
Yeah.
Condoms are definitely should be used, especially if even if you have a long-term partner.
Yeah.
If you're not looking to get pregnant,
No,
I mean,
I know.
use condoms.
And I mean, I
Yeah.
think that we're in the generation now where they don't mind buying them. You know how, when you were young, you'd see these movies and
Oh,
you'd hear
yeah.
about the boys like, oh my God, I gotta go buy those. Like, I hope no one sees me, or the girls getting the pill. People are so open now.
I know.
It's just such a natural part of
Yep.
life now to be out there doing what you have to do
I have a funny story.
without inhibition.
I have a funny story. So a friend of mine had been in a long-term relationship for a long time, and so anyway, had left that relationship and went to one of those big bulk stores and bought like 100 of them because it was like they came in a big box.
Oh, great.
Yeah, they weren't successful in using.
Oh, no! You're a godmother to the child, probably.
Yeah, no, and it wasn't as when you leave a relationship, you think you're going to be free.
Yes,
right?
yes.
It wasn't quite as
Didn't
free.
happen like that.
No, so I just laugh because every
Yeah.
time he tells the story, he's like, I don't know what to do with all of them.
That's so funny.
Yeah.
That is really funny.
I like that, very neat.
Yeah.
Holly, so before, I don't know how long till break, but we're going to at least introduce the topic of cervical screening
Oh,
and the
definitely.
pap smear. And I am so personally big on going for that and detecting and checking my body for hopes that there is no cervical changes down
Yeah.
there and cancerous cells. I'm very good with my body as far as looking after my body.
Yes.
And preventative stuff like exams. I do that regularly.
Me
But
too.
for those who don't, maybe you could tell them why it's so important to get that cervical screening.
I mean, cervical screening is so important because you're trying to prevent cervical cancer from either getting worse. You're just reducing your risks of actually developing cervical cancer in the future. And usually cervical cancer screening starts at 21. Doesn't mean that a younger woman that is sexually active, sometimes they may need a pap test too, depending on their sexual history.
Yes.
So usually it's age of 21 years or 3 years after their first intimate sexual activity. So if something were to develop and a patient did develop symptoms, they should really talk to their practitioner about that, and they may need to have a pap test.
What would symptom be, like a bleeding?
Yes.
Or
Breakthrough bleeding, which is bleeding between periods, pelvic pain or discomfort, abnormal discharge, weird foul smells.
Good to know all this though, because there's girls out there, parents of girls saying, oh, I better, maybe ask those questions.
Exactly.
Or if they're watching the show, some young lady tonight and says, I have some of that, or even one of that, I should be getting screened.
Definitely.
And I do hear, unfortunately, a lot about cervical cancer.
Yeah.
Because people just don't want to go. What is so hard about it? Like, let's just have that conversation. You're the nurse, so I go to you when I'm 21.
Yeah.
And how do you make me feel comfortable? And how do you talk me through this little procedure?
Yeah, it's a really, it honestly is a very simple procedure. It's a simple, quick procedure, but I mean, it is uncomfortable. I mean, you're 21, you're young, you don't want to be going into that position.
Yes.
To get a pap test done.
Yes, absolutely.
So basically, I try and make sure that they are aware that I'm here and I'm going to talk them through the whole pap test. I basically, step by step, tell them what's going to happen so that they are not afraid of what's going to happen. And usually by the end of the pap test, they're fine. And they were like, I didn't expect it to be like that. I thought it was going to be a lot worse.
Because and I've heard this from other friends that are nurses, for you, it's just another body part, like the arm or the hand or the foot or whatever. Like it's not, for us, it's very personal.
Yes.
But for you as a practitioner,
like combing hair.
It's another body part, right?
Exactly.
Yeah.
And the reason why I'm doing it is to kind of make sure that there's no cancer there. That's my main goal is to make sure that you're healthy. So I'm not looking at anything.
No judgment.
No hairy leg. It doesn't matter. You come as you are.
Yeah.
I just want to make sure that you're healthy and no cancer is there.
Yeah. And like I've had 2 children, and it's not like I can't wait to go.
No,
but,
it's not like you're looking forward to it.
No, it's not like I look forward to it, but it's such an in and out and simple procedure. And people, if you're listening, do not fear if you haven't gotten one. Go get one. Protect yourself from cancer, please. And we can even talk a little bit more about that after the break. So we're going to go to break. Come right back with Veronique and I and Holly, because we're going to have a chat very shortly. Hello, if you're just joining us for Have a Chat, I'm your host for today's show, Judy Loge, joined by my beautiful and smart co-host, Veronique Arsenault. Always a pleasure to have her. We've been having an amazing conversation on women's health, women's bodies, prevention, protection, and all of that with the lovely Holly St. Coeur, who's a nurse practitioner here in Miramichi at the Women's Health Center for the Women's Wellness Clinic. And there's so much info, and we just finished off, if you're just joining us, talking about screening for cervical cancer, the importance of pap smears to detect for cancer cells. And just to get back to that very briefly, do you get that report back? And if it is something like wrong down there, like there are abnormal cells, then tell us what happens next. Like if I get a pap test that's not a good, clean one, what then do you advise me to do?
So basically, it depends on the grade of abnormality. So there's different grades that we go by. Now, I always make sure that they are aware. If something abnormal came back, I would definitely give them a call and let them know. If something was normal, everything looked okay, they would get a letter in the mail stating that everything was okay.
Nice.
And that usually a PAP every 2 to 3 years is the way to go until the age of 69.
Okay.
Yeah.
So that's not too often, but it's important to make that.
Yeah, definitely.
Yeah. Oh, good stuff to know.
And also, I mean, just because the age of 69 for routine screening does not mean that you will never have a pap test again. It just means routine screening is completed. It's always important to know your body. If there's any abnormal bleeding, abnormal vaginal discharge, anything like that, you would probably definitely get a pap test again after 69.
Right, because you have symptoms and it could lead
Definitely.
to something very, and that it's curable. Like if you get it in time,
Yeah.
ladies, don't be afraid to go because they can get on it and treat it and then you're good to go. But if you let that go, I know people that have passed from cervical cancer
Yeah.
only because they were too afraid to go for that very brief pap smear.
Exactly.
Sad.
Yeah.
So get on it.
Yeah, and listen, it's not a comfortable few moments. Like, let's be honest, I
No.
mean, it's very necessary,
Yes.
but it's an uncomfortable position to be in
It's
and place
awkward.
to be,
Yes.
right? It's awkward.
Yes,
But-
but I try and make it.
Absolutely.
And let's just say it could be life-saving.
Yes,
Absolutely.
Definitely.
Absolutely. And
So-
a moment of embarrassment or awkwardness is not worth dying
That
over.
is exactly
Right?
the take-home message,
Yeah.
Vero.
Oh,
Yeah.
and we've all had, listen, I get embarrassed at a whole lot of dumber stuff. So a
Yep.
moment of embarrassment is not worth dying over
Right.
for
No.
sure.
Right.
Like it's, or awkwardness or whatever it may be. But we just talked about cervical screening and cervical cancer, but there's other things that, when a young person or a person, doesn't have to be a young person, is sexually active. And so when I was a younger person, we called them sexually transmitted diseases, but they are, that name changed.
Upgraded.
Yeah, that
Yeah.
changed now. They're now sexually transmitted infections,
Yes.
right? So when a person is sexually active, not becomes or whatever, but is sexually active, there's a whole lot of things that can happen,
Yeah.
right? Because we're never quite sure who our partners may
That's
have been
right.
with or whatever, may be involved with. So talk to us a little bit about STIs and why it's so important, again, to get that testing done and to really be in tune with your own body so that you know when things are a little bit off.
Yeah. I mean, everyone should be getting sexually trained. Everyone that's sexually active should be getting regularly screened. I mean, sexually transmitted infections, some of them can go on for years and you would never even know that you've had one or you have
symptomatic.
one. Yeah. So now there are two different types of sexually transmitted infections, some that are sexually transmitted only and then there's bloodborne transmission as well.
Right.
The ones that are the most common, especially within New Brunswick, are chlamydia, gonorrhea, and HPV, which is the human papilloma virus.
Right.
So those are the three that's the main focus, basically. Bloodborne is HIV/AIDS, syphilis, or hepatitis B. And like I said, those are usually screened as well if the patient, you have a discussion if they want that screening done. Then definitely
How is it done?
complete
I'm
it.
sorry.
So that's through blood work.
Okay.
The other one.
All right.
And the actual STI screening is a vaginal swab or just
Oh,
a
it is.
urine screen.
Okay.
So it's very easy.
But you're seeing a lot of that. You're saying chlamydia is prominent in New Brunswick.
Chlamydia is actually the most common illness reported by
Really?
public health in New Brunswick.
If you do have symptoms, what would they be?
So you could have, depending on if it's progressed, because it can progress into pelvic inflammatory disease and it can cause a lot of problems. But in the beginning, it could just be an abnormal discharge, lower pelvic pain. You could have some abnormal urinary issues like burning, burning sensation. You could also have painful intercourse, bleeding between periods, things like that can happen.
But for the men that have these diseases or these transmitted infections,
Yeah.
like say syphilis, how would you, like if they're not getting screened, what goes on then?
Well, for syphilis, that's a hard one because that one's not very, symptoms don't come out too. And if they do, you could develop like fever. Syphilis is more of a one that you want to catch because it can cause a lot of issues. It can cause problems in the long run. So yeah, that is a blood-borne one, so that you would need to do an actual draw of blood to get that. But you could also have swollen lymph nodes, abnormal lesions on the genitals, abnormal discharge coming from urethra or the penis.
Pain probably in the lower
Pain,
and Okay.
So and we'll do a show on men's health as well because because to be able to share the same information,
exactly.
But if they're listening, we know the guys are tuned in too. Like, don't be shy to get your screening done as well as the women.
Everybody needs to get screened.
Yeah, this is a women's health talk, but the men are involved obviously to have these issues
Need
with
to be
the women.
screened. Exactly.
They're in the picture kind of thing.
So at least 1 in 10 women, age 20 to 24, develop syphilis.
Really?
Or not syphilis, chlamydia, sorry,
Yeah,
not
yeah, no,
syphilis.
it's okay.
1 in
Chlamydia.
10.
But
1
still,
in 10.
yeah.
1 in 10.
Chlamydia.
And that's from like New Brunswick statistics. So
that's scary.
I mean, it is. It's a scary thing, and it's one of the main ones.
Yeah.
So
Do you get a lot of girls going for that checkup though? Are you happy with the numbers that you're seeing as far as getting swabbed?
So, for me, with my routine PAPs, I usually do a routine STI
Okay,
screen. So,
good.
sexually transmitted infection screen, just because it's just to cover everything.
Yeah.
Yeah.
So it's
to
2
make-
in 1 deal. It's
It
kind of
is.
fun.
It
when you
is.
go for, you know, it's
It is a two.
We love 2 for ones. We love 2
to
for
go for a
ones.
burger, get an ice cream on the side. You know, it's a treat. We gotta find the fun in all this, girls. I mean, it's not fun being a woman all the time.
No,
But,
but
I wouldn't want to be a man. Let's just say that.
yeah.
I'm happy.
But you know what? Let's we are here on TV talking about all of these issues because they are so important.
They're real.
You know, they're
Yeah.
so important. And listen, we all have those moments when we're awkward or
Yeah.
embarrassed or hung
Yeah.
up on.
I'm getting over it though.
Yeah, well, as I get older, I also get over it more and more. But so I can understand that there are people out there, whether they be young women or I'm 50. I still have those moments. But we need to talk about it. And it's the same with men. We need to talk
Yeah.
about men's health as well because people are dying needlessly.
It's true.
And health
Right?
is really everything. It doesn't matter
Absolutely.
what you have in your life at all. If
No.
you don't have
No.
your health, to me, you have nothing.
That's
No.
right.
Right? You
don't.
can be a billionaire living in a mansion and surrounded by loved ones, and if you can't function well because you're in ill health,
Yeah.
what's the rest of it all doing for
You
you?
won't be able to do
Absolutely.
anything.
No,
So, can't
absolutely.
enjoy yourself.
Anything else you wanted to touch on before we move on there, Holly?
Yes, so another big one is the human papillomavirus.
Right.
So that is an estimated 75% of sexually active patients, females, will develop HPV in their lifetime. Yeah.
75%.
75%.
What happens when you get that? What does that mean if you have that virus?
So the HPV vaccine is, a lot of people already know that it is linked to cancerous cervical cancer. It can be vulva cancer, vaginal,
Gee.
throat cancer. It's
Really?
linked. Yeah, it's linked to a lot of things.
Right.
Um,
That makes sense.
So, but most of these infections will resolve within 2 years. It's the high-grade HPV infections that are the ones that evolve and turn into a cancer of some sort. Now, we do have what is called the Gardasil vaccine, the
Right,
Gardasil
yes.
9, and that is provided to children in grade 7, so
Okay.
the females and males, and it's to prevent the progression of
Right.
cervical
Good.
cancer and anal cancer. in
And that
men.
came later because that definitely was not
No,
in
it
place when
wasn't.
I was a young person.
It's mandatory now?
I do believe that they still have a choice.
Okay.
They do, but the readings are stating that a lot of children are receiving the vaccine.
So do you do, like presentations in front of people, like the parents and the staff, just to inform the kids and parents, like, that this is why you're doing it because of the prevalency of it all? Like, do you ever?
It would be a good
wouldn't it be
idea.
good?
Yeah.
Because
Yeah.
parents
Absolutely.
don't think sometimes that those kids might need that
Yeah.
that vaccination to prevent what it prevents.
Exactly.
And so they just let it go until it's too late.
Yeah.
So sometimes, this is great for the parents listening that Holly's giving you all these cues to make sure that your young lady is looked after, and they're giving them to the males as well, the
Exactly.
vaccines.
Yeah.
Good.
Absolutely.
I want to touch on some, again, it's all women's health here, on some conditions that females acquire in the way of vaginal conditions.
Yeah.
And some of those that are common, and some maybe afterwards you could talk about that are not so common. But what are some of the common ones women deal with?
So, some vaginal issues that pretty much everyone goes through. One would be vaginal yeast.
Yeast infection?
Yeast infection.
Okay.
So those are those chronic itching, clumpy discharge,
Okay.
irritating. A lot of people develop. Actually, it's not as common as you think. Actually, some
No.
people will only get one in their lifetime.
Oh, really?
Nice.
While others will have more frequent ones.
Yeah.
And that all depends on if they have underlying conditions such
Right.
as diabetes, which could
Oh.
increase the amount of yeast in their system.
Interesting.
But yeast infections are a big one, and to kind of deter that is to not wear like silky satiny underwear.
Right.
Tight. That makes you irritated.
Tight clothing.
Like,
try
So that air
cotton.
can't circulate.
Exactly.
Okay.
Cotton underwear are usually what you kind of go for
That's
with
good.
if you're having reoccurrent vaginal yeast. Try not to soak or bathe in like bath bombs or sudsy bubble
Yeah,
bath.
I told Holly too. I
Yeah.
know people that can live in a bathtub
Yeah.
with the bubble baths, and
Oh,
that
yeah.
would just cause me to have a problem if I did that. I know from the past that I just can't
Definitely.
lay there in the tub.
Yeah.
No.
It causes me to be very uncomfortable and maybe go with what you're talking about.
Oh, it definitely can.
Yeah.
And I mean, it is easy treatment.
Yes.
Usually there's over-the-counter medication that you can take, but always check with your practitioner if there's any abnormal vaginal
Right.
issues whatsoever. Just
Right.
it's always good to kind of check up. Another common one is bacterial vaginosis.
Oh.
I see a lot of people with bacterial vaginosis. It's something
Sounds
that
complicated.
it's
sounds
not. It's
yucky.
very
Sounds
very
gross.
easy. It's something that develops usually within the cycle, menstrual cycle. It could be seen before your menstrual cycle, during, or a little bit after. Usually, it resolves within 3 to 4 days. Now, if it's a foul, fishy smell, it can be like a grayish discharge, thin, a lot of it. Now, if that doesn't go away within 3 to 4 days, that's when you need a little help for it to kind of,
For sure.
you need an antibiotic to help it kind of go on its way.
Right.
Okay.
Out the door.
Out
Yeah.
the house.
Out the door.
Out the house.
Yeah. So yeah, those two are the most common.
Yeah.
Now we will touch on vaginal atrophy, and
Okay.
which is like almost like a perimenopausal, postmenopausal issue.
Yes.
We will touch on that with perimenopause and menopause.
Okay.
But yeah, those are basically the main ones that I
Yeah.
see a lot of. Cervicitis is a rarer one.
Cervicitis.
Yeah.
Which
I've
is
never
what?
heard of that.
No.
It's almost like inflammation of the cervix, and it's
Oh.
usually associated with sexually transmitted infections.
My gosh.
So I don't see very much of that often, thank goodness. But yeah, it's another one that can, and it's usually associated with purulent discharge, so like a foul-smelling,
Yeah.
different colored discharge, and usually pelvic pain is associated with it as well. Yeah.
But are you finding your word is spreading? So Veronique and I were young women, 21. And I said, look, I went to see Holly. She was great with me. She did all the swabs and checks, and I had myself checked out. Is the kind of effective for other young people to talk about it? Is it getting more
I hope people are more aware of us.
aware? Is a
Yeah.
good word.
Because you need women's health at any
course.
point. There's things in our lives that happen, and we're like, a man doesn't develop this. I need someone
Absolutely.
to help me.
Yeah.
Yeah, I feel, I'm hoping that the word is getting around, that we're available and we're there for anything women's health, and hopefully people are.
Well, and even pulling it, like even having the clinic itself, right? Like that's pulling it out of the doctor's office. So
Yeah.
like a lot of patients might have a male doctor, and they might not be comfortable going to their,
Exactly.
to their family physician, right? And not because they're not wonderful physicians,
No.
but just it's that thing, right?
Yeah.
And so
Yeah.
to have the women's health clinic and to have yourself and have that option is such a wonderful opportunity, to be more comfortable in an
Yes.
uncomfortable situation.
Because I have been through things that you've been through. Being a
Absolutely.
woman, you say,
Yeah.
I can relate to that.
Absolutely.
And it's just maybe the conversation is just a little bit more
A little
easy
easier.
sometimes, right?
Yeah. You try and make it sure that they feel comfortable. You
Right.
don't want anything to be.
Yeah.
Yeah.
Absolutely.
Yeah.
No, I think it's fantastic, and I have been to the women's health clinic, and it's always been a great experience, and it's. Again, it's never a situation where you're like, oh, I can't wait to get there. Woo, yummy. But so critical, and that's one of the things I'm not great at taking care of myself, but that is one of the things that I have always been very consistent at is making sure that I get my regular screening, and because it was always up until not that long ago, it was always yearly.
Yes. Yeah.
Right. So
Yeah.
that even that's changed now. Like it was yearly up until.
Yeah.
Well, that's all I've ever known is yearly.
Well, at my age, I'm way more afraid now of what the results might come back as opposed to getting it done.
Yeah.
So when
Yes.
I go in there, it's like this is not like a joyride or anything. It's just simple and fast, though. It really is, girls. Don't be afraid. But then when you say, oh, everything's good, that's just, whoo,
Yeah.
No, I'm
lifted.
so thankful. I'm looking after myself.
Check mark, off we go to the next thing.
Exactly.
Yeah, absolutely. But we never think twice about getting blood work done.
No.
Or, oh, I hurt my wrist, or I stubbed my toe, or I broke all of my toes, or
root
my
canal,
teeth,
whatever.
Root canal, not so much,
Oh,
but
I've had
me
a couple.
too. But we don't think twice about that, right? Because we may not like it, but we know that we're in and out, and once it's dealt with, it's gone. Or I have a chest infection or whatever, I'll just go get an antibiotic. And we don't think twice about it, but we often think about. And I'm not great. There's also colon screening, right? I'm not great at that one.
I'm due for that too.
And I am too, and I'm not great at that. And it's my own embarrassment, and there's no good reason for it.
No.
Right? But I know, like, I was just having that conversation with a friend of mine, and he's like, just go.
Just like Nike has it down
Just
to
do
their
it.
motto,
Just do it.
Yeah.
Because that's like, it's all about keeping yourself healthy.
Absolutely.
Yeah.
And we only have like a few seconds left before we go to break, but we're going to come back and there's so much. You do love your job, right?
I do
you
love my job.
Preventing and talking and helping women and knowing that you might have saved a life or two.
Yeah.
Well, we have Holly St. Coeur with us. She's going to be back very shortly again for more Have a Chat. Join our conversation, ladies and men. And here in Econ Holly, we'll be right back. Hello and welcome back to Have a Chat. If you're just joining us, we're having a fantastic conversation about women's health, all that can go on with our bodies, prevention. It's a women's topic day. And so we have Holly St. Coeur with us from the Miramichi Health Clinic. And she's here to talk all about the job she has as a nurse practitioner. And we've been having a great talk. But we're going to talk right now about the importance of breast screening and cancer screening, of course. And maybe you could just talk to us about the importance of self-examination and how often you should go for the actual breast screening part of it.
Yeah.
Go right ahead, Holly.
So breast cancer is actually the most common diagnosed cancer in New Brunswick for women, and is the second leading cause of cancer-related death.
Really?
Yes.
Oh, boy.
So mammograms are there to detect tumors early so that we can treat them and it doesn't go to the point where it's untreatable. So mammograms are super important, as well as self-examinations. Now, mammograms start at 50 years of age.
50?
50.
Oh.
Yeah, 50 till 75.
I'm kind of surprised at that, actually.
And
I
there
feel like
is,
it should be lower.
I think there is some talks about
Going earlier?
Going earlier.
Yeah.
Now, that is not to say that if you have a family history,
Yes.
a strong family history, or if there's, if you've had a personal history of breast cancer, then you would go annually and you would start at 40. Okay? Now, yes, breast mammograms are amazing, but the real thing is self-examination because you know your breasts well. You know everything about them. So if something changes, you're going to be the first one to know. So that is when you would book an appointment with your practitioner and get a mammogram or an ultrasound completed.
So some signs of breast cancer without having gone for your mammogram would be redness or tenderness or a rash.
Changes in skin at all.
Like the skin texture and
dimpling of the skin, nipple discharge. Anything like that that's not normal.
Didn't know that.
And I might as well just be honest here. I'm not really sure that I'm doing a self-exam properly. You know, there is a certain way, and I know when I go to get my checkup from the gynecologist or a nurse practitioner that it's a very light. I was surprised at how light. Is that because something will pop out? Do you know what I'm saying? Like you don't press.
And I mean, it's for your comfort too, right?
Okay.
Usually I start from the middle.
Yep.
And then
Outer part?
the middle, and then work my way down all the way until I get to the next section.
All right.
And I'm not as light as some people because I like to feel to make sure
dig in, so to speak.
Yeah.
I don't like to cause pain or anything, but I like to make sure that I'm getting a good breast exam to make sure that I'm not missing anything, because some breast cancers can be very small. They can be the size of a pea.
Yes.
So I would feel terrible if I kind of missed something.
So again, and I think I've talked to you about it, women, and some women in my family, including myself, have a more fibrous tissue in the breast. So that would appear as like, is that a lump that I'm feeling, or is it just a tissue that, what is it actually, fibrous tissue? Is it an inflammation of the tissue in the breast?
Some women are more prone to cystic breasts. So cysts in their breasts, or almost like a lumpy breast.
Yeah, I don't have that though.
No.
It's just more of a density in the
More
tissue.
density.
And not smooth sometimes. Like sometimes yes. Sometimes you can feel a little like a
little bit of inflammation, like it, yeah.
Fibrous, like
Yeah.
And I
it's
think
true.
my sisters and some of her
Yep.
friends and my friends have the same thing. Should that be a concern?
Well, the recommendations are, well, it's even if you have fibrous breasts, it's usually every 2 to 3 years
For an exam.
For exams, not 2 to 3 years. I'm thinking of pap tests. Sorry,
Yes.
that every 2 years for mammograms.
Right.
2 years. Okay.
Now, with that, I feel like you should have annual breast exams with very dense breasts like that.
Okay.
And usually they have categories. So it's from A to D, where they look at breast density.
Yeah.
A being the fatty tissue.
Okay.
The breast is fully, there's not much there. It's basically a fatty tissue.
Okay.
And D is the more fibrous, kind of cystic type of breast, where it's lumpy, feeling more lumpy,
Yeah,
more
no, I don't
dense.
have much of an issue like that.
More thick.
Really, it's just mild.
Dense doesn't mean big,
It doesn't mean big.
I
right?
wish.
Yeah. Dense, because I don't want people thinking, well,
No.
I have really, A cups
No.
are small, and so I
Yeah.
can't have a dense,
No, it
breast
wouldn't
or
matter
whatever. Right.
then,
So
would it?
dense
Doesn't
doesn't
matter.
mean big; it just means the type of tissue that's in there.
Exactly.
Okay.
And I mean, fibrous or dense breasts are more prone to cancer
Right.
because most of the time you can't see it or feel it.
Right. I've had really good examinations
Yes.
and very good outcomes,
Yes.
and there's a history in my family,
Yes,
so I'm one of those
definitely.
very vigilant people to get
Yes.
it done. And it's
Yeah.
a birthday gift. I usually get it done just ironically every June.
Yeah.
And when that letter comes in the mail, Judy, everything's good.
Yeah.
It's just like, thank you.
Yeah.
It's a gift.
Yeah.
Well,
it
and the
really
other
is.
thing that I've heard often is that, well, I get my partner to check. I don't do my own. I get my partner to check.
Yeah.
I'm too embarrassed, which is good, I think. But also, you want to do your own, right? Because you know yourself better. Like
Exactly.
your
Yes.
partner may not know what your tissue feels like normally or
Yep.
whatever it may be. So although that's better than nothing, it's
Exactly.
not the optimal either,
No.
right?
And I mean, exactly, you know your breasts. So you're going to know if there's a change. And I always recommend to make sure you're not just going at the breast.
Right.
Go underneath the armpit, up on the top up
Yep.
here, because those are the spots that sometimes are
Sure.
missed.
Stay high, eh?
You hear about the
Yeah.
cancerous breast that leads to the lymph node
Yes,
area. and
exactly.
Exactly.
Very scary
Yeah.
stuff. Get your screening, ladies.
Yeah.
Get your breast screening done
Yeah.
and do your self exams.
Yeah.
It's so important.
Yeah. Now we'll talk about the other thing, which is where I'm at in my life. Right, so I'm way past puberty now, but there's been so much information, but let's talk about perimenopause, menopause, postmenopause, all of those things, those
Wonderful things.
fun symptoms that just pop up all of a sudden that we never
that are
expected.
inevitable.
Yeah, never expected, and so let's talk about that.
Yes. So I see a lot of perimenopause and menopause in my practice. Basically, perimenopause is that kind of lingering waiting period before you get to the big old menopause. So it can last up to 5, 8 years. And it just, you get all the symptoms. You can get the hot flashes. You can get the vaginal issues. You can get a little bit of vaginal dryness. You can get mood swings.
Oh, I cried.
Yes.
That was I've never yet, just admitting on the air, ever had a hot flash.
Yeah.
I'm in my 60s. I've never experienced one.
Yeah.
Ever.
They're not great.
No, but I don't know I don't even know what it is.
not great.
So don't hate me. Don't hate me
0
because I
out of
have
10 do not recommend.
But when I was perimenopausal, like I'm talking when my first son graduated in grade 12, all I did was cry.
Yeah.
And I'd be crying over nothing. And it was just hormonally,
Yeah.
it was out of control.
The hormones are just kind of fluctuating at that time.
Wow.
Yeah. And I mean, your periods could be all out of whack too.
Okay.
And it's not abnormal. Usually I make sure that to get you to write your periods down.
Yes.
The only way that you really know that you're in menopause is a full year without a period.
Right.
So that is the definitive you're in menopause.
It's one of the happiest days of my life, actually.
Yeah.
It
Had a
was.
party.
It was. I
Yeah,
like
yeah,
it.
I get it.
Celebration.
So, I mean, and there's so many symptoms. You could Google
For perimenopause?
perimenopause, menopause. There's so many symptoms.
Like hair loss and stuff like that? Or?
Hair loss,
Oh
hair
my.
changes.
Acne or?
Acne, there probably is. I wouldn't doubt if there is, but there is lots, and night sweats is a big one.
Never had that. Never did.
Oh, it's 3 o'clock every morning. I wake up just hot.
But the vaginal dryness is a big one, and I see a lot of it.
So what do you do then? Get like a lubricant, or is there something women's products that can help that terrible feeling?
Always important to see your practitioner to make sure that's what's the cause, because there could be other things going on.
Sure.
But yes, if it is diagnosed vaginal dryness or vaginal atrophy due to a lack of estrogen,
yes,
that's a terrible word.
What?
Vaginal atrophy.
I know.
Well, I can kind of relate.
That's
a terrible word.
I know, but it's a real.
I understand it's the right word.
It's a real thing.
I totally understand it's the right word. It's just a terrible word.
But you don't know what hits you, because vaginal atrophy is like this burning, seething kind of feeling in that netherland.
Yeah.
And you should go really see somebody about it. Nobody should be living in discomfort.
No. And I mean,
or intimate partner relationships that suffer because the woman's like, oh no, it's painful, or that shouldn't be happening. It's preventative, right?
Yes.
Or treatable.
Treatable.
Not preventable.
Treatable.
Yeah, exactly. And you can, it's so treatable, and that's a sad thing, because people have been living with it for years and years. Vaginal itching, dryness, pain. Can't have intercourse, burning because it's so painful. But yes, there is treatment, and lubricant is definitely one of them. And like I said, go to your practitioner. They can give you the right lubricants. Not all lubricants are made the same.
Right.
Some are formulated for the postmenopausal woman.
Interesting.
Yeah.
Interesting.
So,
am I crazy, or to ask this question, I guess I'm just going to ask it.
Absolutely.
If you don't go and you have vaginal atrophy, that just gets worse and worse and worse. Doesn't it eventually cause the vaginal area to shrink, like to be so much so like affected that to get a pen in there would be difficult?
it could cause a little bit of like a blockage.
Yes.
And it could also cause bleeding and unnecessary tearing and
right on. You have to get it looked at.
It is something that a lot of people deal with, and they just don't want to go to the doctor because it's embarrassing, or they don't think that it's
that bad. That they're just going to live with it.
Yeah.
So why would I never have a hot flash? Do you know? Can you answer? Do you have any thoughts on that?
I mean, some people do.
Everybody's different.
It's genetics.
Yeah, but my mother had night sweats. My sister in her 50s. My sister in her 30s. My hairdresser was full blown at like years ago when I lived away. At the time in Fredericton, she was 30, going through it all.
Oh,
I'm thinking.
Mom had no symptoms though.
Okay, neither did I.
No, Mom had no symptoms. She didn't have the hot flashes or anything.
It's wonderful.
Mine are not like, I have known some dear friends who are like it's instant and they're like in a pool.
Yes,
right? I don't have that.
No.
I will just all of a sudden I'll be like, oh, it's warm.
Okay.
Like, oh dear.
Yes.
But I don't have, it's almost like, you know that feeling when you get embarrassed? You get like, you get that little kind of that warm feeling. It's like, oh dear. So that's what mine are like, except at night I sleep very, very warmly, I call that. But one of the, but everybody's symptoms are all over the place, right?
Yes.
And the one, and I've done a lot of research on it because it's been around for so long for me, is I have an itchy ear. I have a terribly itchy ear, and I've had it checked repeatedly. I've had it, there's no infection, there's no no allergy or whatever, and that it is one of those symptoms, and I'm like. Some days I could just dig it out with a fork.
And you're so saying that with female, like your stage in your life?
Yeah, I've done a lot of research on it, and they say it is one of those symptoms.
Wow,
there is a large.
Spectrum,
there's a large spectrum of symptoms.
We don't have a whole lot of time, but I would like to touch on. So, what would you say to women that are in menopause or postmenopause? What should they expect? Postmenopause. Let's go to just
postmenopausal.
Jump to postmenopause.
I mean. Most people, the hot flashes will kind of go away, and all of the symptoms will kind of deteriorate. The symptoms that they've been going through with perimenopause, all those terrible things. You won't have your period anymore. But I mean, you with postmenopause, you always want to make sure that you're taking care of yourself. So if you ever developed vaginal bleeding after 1 year of no bleeding. That is a big red flag.
Or 10 years of none.
Exactly.
Right.
You need to make sure that you get to your practitioner and get checked, because that is not a normal thing to be happening postmenopausal. And make sure you take care of yourself. This is the time in your life where
You want to live.
you want to live and you want to do things.
And be
Just
healthy.
be healthy. Yeah. So make sure you're going to see your doctor regularly and taking care of yourself.
Okay.
Yeah.
I just think like of these women that think, okay, I'm all done now, nothing can happen, then have a baby. Like those midlife babies.
dear.
That can be a shock because they don't realize that there's still estrogen in their body that's
Definitely.
sufficient enough to be fertile
Yes.
to produce a baby,
Oh,
right?
definitely.
You see a lot of older
Oh,
women
dear.
having babies now.
Yeah.
Yeah,
Truly.
absolutely.
Yeah.
Well, women are healthier too longer, right? Than they would have been at one point. But oh dear.
I'm just hoping people enjoy the show because let's just face it, we're all humans and and the men go through different things, experience they can relate to one another. We as women can talk and
Absolutely.
relate and say, oh yeah, well that's good to know, or I've had that. And so we're talking about things that are real and hopefully will save lives.
I hope so.
Yeah. Any final messages, Holly? Like anything you want to say or tell young women or middle-aged women or elderly women? What's some really important thought?
Just keep getting checked. Make sure that you're making regular appointments for pap test, breast exams. Make sure that you're getting your mammograms completed. These save lives. You're helping yourself in the long run, really. And just keep on top of your women's health care.
Yeah.
Okay.
Really.
Ask your physician, right?
Yeah.
Your family physician or
Yeah.
your nurse practitioner.
Exactly.
Really quickly, in our area, can you just give us some information as to where you're located, if they want to reach you to make an appointment? I know how busy you are lined up with clients, but patients, but however, what even phone number could we say a couple of times on air?
Yeah, so the phone number at the Miramichi Health Center is 506-627-7511, and we are located in behind the courthouse in Newcastle, 679 King George Highway.
Okay, just give the phone number one more time
Yeah,
because I know
for
people
sure.
should be booking an appointment as we speak.
Yes, exactly, 627-7511.
Yeah.
Okay,
So much great information.
Yeah.
Yeah.
Amazing.
and so you're getting checked?
Absolutely. I'm very regular with my checkups.
Yeah,
Absolutely.
good. And you too.
Being
Being a woman a nurse practitioner that does this day in and day out, then you're really on top of
I
the
am
things
very
because
on
you
top
see
of
what
it.
can happen if you're not,
Yes.
right? Anyway, we're going to have a great show next week too.
Absolutely.
And if anyone's listening and has an idea that they want us or a guest that they want to suggest that we bring on, we're very open to that. We take some time off during the summer later on, but we're full of shows between now and August. So if you have some thoughts as to, oh, the girls might like to interview that person, throw them into our Facebook chat. And we're really thrilled that we had you on, Holly.
Thank you
and
so much
I'll be
for
going home
having
to do a
me.
breast exam when I leave here.
I know,
and Veronique
I
will be
know.
booking a test.
Absolutely.
Yeah.
Yeah.
Any little message to like young girls, like how? Just before we go, I want to get it in. When should the first age be that they go visit you? The youngest.
At any age.
Any
You can
age.
come visit me at any age with any female issues. So even if they had a vaginal issue at the age of 9, I am
Oh.
okay to see them and
Yeah.
to see what's going on.
And have a great conversation.
Exactly.
Do you have to have the parent always present when they're underage?
Yes. Yeah, definitely.
Okay.
Definitely parent will be there.
Well, anyway, what I wanted to say was, I want everyone to have a great week, and I can't say strong enough how this lady has impacted your life just by the information she's given us. Have a beautiful week, everybody. Enjoy the sun while we have it.